So we work with our backup doctors in the hospital. So we work 24-hour shifts in the hospital. We have OB hospitalists. So that's awesome. They don't do OB/GYN appointments. They just take 24-hour shifts in the hospitals. They've all had lots of experience as OBs. So they are our backup people in the hospital. And we are, even if you don't meet them, we're communicating with them really well. So if I have somebody who's trying to have a VBAC, I've told that doctor, hey, so-and-so's here, we're doing this, everything's fine. I'm keeping her updated because that also keeps them out of the room usually. So, you know what I mean? Like, we're doing stuff, we're safe, we're communicating really well with the doctor. And then that way they already know what's going on. So if I go, ooh, now this baby doesn't look like it's okay, or you're not okay, or something, you're bleeding to, I don't know, something's not okay. It's not the first time they've ever heard you were even in the hospital. They know your story. And sometimes, especially if you're something like VBAC, where it's something where you might need a C-section, they're going to come in and introduce themselves to you before things are hard and then step out when you're working hard. So they're involved even if you don't actually need that. Does that kind of make sense? So the OB hospitalists would be the ones that would do a C-section in the middle of the night if we needed one, or say you've been pushing for a long time, it's just not going to work.
Well, and sometimes we'll be given an update and, we get that question of, well, why haven't you started Pitocin? Well, why, and it's like, I discussed it with her, here's where we're at, here's the conversation. So I think sometimes there's like behind the scenes, there's those like questioning, but I feel like they do a good job of supporting us, even like in the patient room, going in saying like, I know you've had these conversations, here's my recommendation. They need to hear you say, and I refuse. Yeah, but I think it's been pretty seamless overall.
And like our OBs, like, with patients that are trying for vaginal delivery, and for some reason that we've done literally all the things, they know they're like, yeah, they walk in and they're like, midwife can't get the baby out, then there must be some reason, something going on the inside, and then chatting through that, what does this, abdominal birth look like? What can we do? When we get back to the OR, can we do skin to skin? And, what can we preserve, in the switching of the delivery? But yeah, they really are really supportive of, and want to come in and support us in what we're doing, because we've had other patients like I've done, maybe the heart rate was low and we needed a vacuum because, we need baby to come and they're so close, where they do the vacuum for a little bit, they step away and then we deliver or catch babe, so we kind of, have a very unique, working relationship with that.